We are very lucky today to be joined by our speaker, Eugene Barsky. He's a research data management librarian at the UBC Library Research Commons and an adjunct professor at the UBC School of Information. He has a wealth of experience curating and managing research data here at UBC. Plus, Eugene is involved in building various federal and international data repository services and is one of the founders of the Portage Network in Canada. In addition, he has published over 30 peer-reviewed papers, presented at more than 70 conferences, and has won numerous awards from various library and education societies. So thank you so much, Eugene, for taking the time to lead this workshop today, and I will let you take it from here.
Thanks so much, Nicole. And thanks for taking the part of your day in the afternoon to join me. So this workshop is rather hands-on. So I hope you have your laptops ready to go. And all the materials that we do are open access, computationally producible, and self-paced. So everything we will cover today, you can come back and build upon. It's all our materials on GitHub, and you can reuse them in any way you want. We have more than 50 different workshops on GitHub, from SPSS to R to APIs to Unix shell to a variety of other tools. But today, I wanted to talk about the very basics of research data management. And we only have 45 minutes or so, so I'm going to jump right in. So the materials I shared with you in the chat, and I invite you again to actually open your cameras and play along and experiment and see how things work for you. Please stop me, raise your hand if things are interesting or have questions to ask, or something I say confuses you, because it will. So I'm going to share my screen, and we'll get started. And again, I anticipate that all of you are not early career researchers. You've actually been around for a while, and you are not undergrad students. That's my assumption. I might be wrong. But the materials I will cover will tailor for this level of research. So I also acknowledge that I'm very grateful to be working and living in Musqueam. And if you are joining us from elsewhere in Canada, you feel free to use nativeland.ca to see where your lands are located in Canada and what nation's land they belong. The first part of the workshops will be file naming. I know it sounds very basic, but all of us, or most of us, are guilty for not naming our files quite well. And I would like to give you some basic information how to make sure your file names work with your code, how to make sure that the files you give to the names you give to your files will work in your R or Python script, or will actually make sense to you when you look at them in the 5 years. So again, as I said, all the materials are available in the link I shared, and I'm going to share it again for people who just joined us. The materials we start at the file naming workshop, just here. In my mind, I also had the idea that we will actually experiment and play along in the Padlet, and the link to Padlet is I'm going to share it in the chat. It was shared before in your registration as well. So I think we have time to experiment and play, but let's see. So the Padlet allows us to all type at the same time and share our results in the chat. Or on the screen, if you click on the plus sign, you will be able to share the work you just do. It's anonymous. I don't know who is coming from, so we can experiment. But let's jump right in. File naming. So many of us do not name our files very well. If you look at your last directory you're working on, you might be surprised to see what you find, or you want to share it with your colleagues, and you might struggle to make sense of what the other people mean by the file names. So we need 3 basic principles with file naming. The file names that you need to give are supposed to be machine readable, they're supposed to be human readable, and they're supposed to play well with ordering. And they apologize for the cartoons. They are done by one of my daughters who is studying data science in UBC. She was experimenting with GitHub, so they will change soon. By what do we mean by machine readable file names? We usually do not include any special characters in the file name. This is important because most of us do. And most of us include the spaces in the file name, and many of us include the dots or colons or commas in the file name. And as a result, once we do that, when you point your, for instance, code or to your file names, they will actually not they will not process. They will not work because most computer programs do not like special characters in the file name. So important not to include any. The only thing you can safely include are two things: underscore or a dash. Underscores and dash play quite nicely in the file names. So just remember that not to include any special characters. I can explain why for each of them what it means. Like for instance, if you have include a dot in the file name, your computer will assume that whatever comes after a dot is a file format, and it's just a string of names or numbers. The code will be confused about what to do next. And so for each of those special characters. So don't include any. Include a dash or underscore, and you will be fine. I will not do little exercises actually because I have a lot of content to offer, but do use a chat or raise your hand if you have any questions to ask. I will be looking at it from time to time. Next is that our file names have to make sense. They have to be understandable by humans. So, which means if you use very short or abbreviated file names, you might actually not be able to make sense of them quite fast. If you use, for instance, if you do an experiment and you abbreviate your names, you actually have to define it in your README file. We'll get to README files very soon. But the file names, again, it's not a rocket science here. They have to make sense. And you would usually separate elements of the file name by an underscore, as I told you a second ago, or by a dash. So, for instance, it might be an experiment. You will call it experiment 1 underscore date underscore initials of the experiment. Somebody who is taking that experiment. Next is your file names have to play well with the ordering, because you actually want to make sense of them in a directory when you organize them, especially if you have many files. Like if you have a sequential scanner and you automatically record scanning numbers, they have to make sense. So we usually tend to use an ISO standard for names and dates in the file. And the dates have to be recorded in this format: year, month, date. When you record it this way and you ask your machine to organize it in a directory, or ask your code to organize it in a directory, it will do a good job. My own practice is if I create a file, and this file is for my own use only. If I only going to refer to this file myself, I will name it well according to the principles I gave you earlier, and I will put a date at the end or in the beginning of that file name. Again, it's aesthetical, just aesthetics preference. So some people like it in the beginning, some people like it at the end. I like it at the end. I like the file elements in the beginning, but some people like it in the beginning. So once you order it, it will make more sense in terms of a directory structure. So if I do it for myself, I don't use a version number. I use a date. This is a file I'm going to share with my colleagues, I also create a version. I would use a version V001, 002, 003, and so on. This way, we can all refer to the same version when we work on the file. I want to see if there are any questions. So 3 principles: don't use any special characters, machine readable, human readable. When you look at it, you make sense of it. And 3, use a date in ISO format. Easy. Okay, next one. And I do actually want to experiment here. So if you have a machine, you are going to file format page. And for each of those workshops, I also have a one-pager, by the way. So if you want to take it away, if you want to take this file names issues away, or want to take questions about file formats, there's a one-pager that we run. It's version controlled, and that document is a takeaway document where we explain why file format matters, what to include in the README file, and so on. So each of those workshops comes with a one-page document. If you have a machine, take a look at this little exercise. I have a colleague in USask, and he has been around for a while. So if you went to school like I did 20 years ago, and you saved your documents in a specific format. 20 years ago, again, if you worked in academia, you had options of Word or WordPerfect. It was another suite that we all had access to. So this gentleman kept his files in WordPerfect, which was the default software for University of Saskatchewan. Try to open this document, see if it can. See if you can open this document. I gave you the link. The document is in a proprietary format in the WordPerfect. It's extinct. It doesn't exist anymore. Give it a try. Share it in chat if you can open this file. I'm going to do it myself. I'm going to open it with a Notepad. It is the simplest file format I can try to open. I want to see what happens with yours. I'm actually going to stop sharing for a second. I'm going to share my entire desktop instead of sharing just the browser. Do you see my Notepad? Anybody can? Thank you, Angie. I want to see what you got. Notepad is junk. Okay, let's try something else. Let's try to open this document and let's try to open this in Adobe. Try to open it in Word. Try to open it in Typora. I use Typora a lot, which is a markdown software. Let's try to open it in Typora. Here, it is much more sophisticated much more sophisticated program to open text documents. I actually don't know what to expect. Let's see. It doesn't work. So that's the problem. So I wanted to give you this example because you might have encountered this one before. So if you work with the proprietary file formats, those are not preservable in the long run. So if you try to open your own files 5-10 years ago, it might not work because the digital information is unstable, it degrades. So our biggest piece of advice, if you have a choice, do not use proprietary formats. If you work in Excel a lot, try to use, if these files are important to you, try to use CSV. If you work with text a lot, if the files are important to you, move them from for Microsoft formats to text or to PDFs, which is something we can open and preserve for a long run. My recommended file formats are here. The biggest difference is the newest Microsoft Office formats, the ones that end with the X, so DocX, ExcelX, are open formats. So if you do want to make sure your files are around for 5-10 years, you either convert them to non-proprietary formats like CSV or TSV for Excel spreadsheets, or if it's a database, then you might consider SQLite. Or alternatively, upgrade them to the XML version of the Office, which is a DocX, ExcelX, and so on. So those two formats will really ensure that your files are around for a while. Want to see the chat? Excellent. So somebody actually converted to DocX, which is an open format, as I said, and it worked very well. I'm running through the content, so I just want to see if there are any questions for that. So if you deposit data in our repository, for instance, in one of the UBC repositories, we have two, and we curate those data sets. We have more than 20,000 data files. If you deposit it in a proprietary data format, I will actually send it back to you and will ask to convert it to non-proprietary format, because we want to make sure that in 5-10 years, our communities can open the data and make use of it. Any questions? Does make sense so far? So the content I'm presenting is not complicated, but it's unfortunately it's something we tend not to do very often. So it's just easy to forget, easy to disregard. So this is important. We want to ensure the data is around. Okay, the next one is a README file. It's not unusual for folks, especially in health, to actually not know about README files. It's something we used a lot in the physical sciences, in the data world, and computer science. If you work in any GitHub repositories, you will for sure have encountered README files before. If you deposited data in any repositories, in most cases, we will ask you to provide a README file. So what is a README file? The one pager is here in the beginning, as always. The README file is a very short, holistic way to describe what people are looking at. If a README file is not provided, and the variables, for instance, are not defined, nobody on earth will make sense of this stuff. And I have an example for you to experiment. I gave you a data set from our colleague in psychology. I published this data set a while ago, and if you work in gambling, you might be familiar with this researcher. He's in psychology at UBC. Try to make sense of it. Try to open this data set. And try to answer any questions that I have below. Just take a minute to do that. So I'm going to go to my repository. I'm going to grab the original file format, which is tab delimited. Excellent. We want to have a tab delimited file format because it's non-proprietary. Download it. I'm going to open Excel. Going to try to open that file. Try to open it yourself. Tab delimited. Tab. Excellent. So here's the file, and has stuff. For instance, I want to understand what I want just to make sense of this data. What does pleasantness mean? If you look at the data set, the variables here, there's no README file. I published this data as an example of how not to do things because it's an excellent example, and I always get our users get in touch and say, how do I make sense of it? You cannot make sense of it. The data is not defined. There's no data dictionary. There's no README file. The data it doesn't make sense. It's useless. There was no reason to publish it. There was no reason to share it. That's unfortunate because somebody actually used a lot of public money to collect this data, to analyze this data, publish an article, but the data is not usable. So what we are trying to say in this case, we share the data, but nobody can make sense of it. So a README file is supposed to change that. You folks work in health and health sciences. You are very much familiar with defining your variables. You either use a data dictionary or code book to define variables for your studies. You actually want to ensure that you have that. And if you don't have that, a README file is a place where you're going to define all your variables. It's a place where you're going to say what people are looking at. In most cases, README file is the one your users, your data users, or your colleagues or yourself will be the first place to look at. How to create a README file? I give you a template. We have a template to share, and it's usually quite simple. The structure for README file is quite simple. If you open any of our data sets in UBC, we have a small to medium data repository called Borealis, and we have a large data repository for big data sets. So here's the file, here's the data published. What day is today? 29th. We processed it yesterday. And if you open these data deposits, you will see that each data file that we process has a README file. It actually explains what people are looking at. It explains the variables people are looking at. It explains the license people applied for this data. It has a file list, and it explains various things that need to be explained that are not intuitive. Without a README file, without a data dictionary, this deposit is useless. So if you do decide to make sense of your own data, or if you decide to publish your data for the world to see, a README file and a data dictionary is essential for making sense of your research. The template of creating README file is here. You can usually create README files, the template. Usually README files are created in a plain text or in a markdown format. I'm a big fan of markdown. Everything we do is usually a markdown. All these pages are markdown language, but as simple as possible, because otherwise nobody will actually make sense of what it means. I want to pause to see if any questions. Okay, I take this as this content is self-explanatory, and you can proceed. I have two more sections to cover, and then we can open. I will stop sharing, and we can have a discussion. The next one is the directory structures. This is where we explain, again, here's a one-pager, how to organize your directories so they will make sense. Again, many of us, again, this is not unfortunately, it's not a science, it's mostly art, how to organize your data in a directory. And we give you an idea of how we tend to do it in a data science profession. So we usually have a root directory for a project root directory, and we subdivide the files into experiment data and reports and analysis. However, the one thing is not mentioned here is actually making sense of what people are looking at when they look at the directory. So therefore, when you work with a research project, we really recommend to add a README file to the root directory that describes what this project is about. And if you have acronyms, EXP1, EXP2, EXP3, you actually need to define them in your data dictionary. And if the project is not large, if the project is self-explanatory, the README file can serve as a data dictionary too. We have seen many times when people use a README file to define their variables. If the project is complex and you're using things like REDCap, for instance, you will know that you need a data dictionary, and it will be standalone file. And this standalone file will need to be shared in your subdirectory. I have an exercise, obviously. So usually when you end up in a folder, you will see something like that, and it's messy. It doesn't help us. The file named well because Jason Peter is a great colleague of mine in the EBCO. He actually worked with us for years. He knows how to name files, but they're not organized. So in our exercise, and we are not going to do it, but in our exercise, we will ask people to try to organize his files for experiment into something that makes more sense. And when you organize it is something like that, you will actually make more sense when you decide to share this data. I'm going to go back to our data repository, for instance, and I'm going to take a look on one of the data files, for example. Like this one. Actually, it's in your field. It's a human kinetics data file. We published it a few days ago, and this file. This is a flat representation of the file. So we have all the files in that directory just displayed in flat way, and it's really hard to make sense of it. But when we switch it to a tree, you will see the data is organized very clearly. There's a README file that describes what this project is about. It also defines the variables if you open it. There's a code that describes what was the code used in this data. There's the data itself, and here are the results. It really makes a huge difference for your users when data is displayed this way. If you just look at this table in a flat variation of the data, which is, you actually have to look for stuff. Where is that README file? Where is that code file? It's really hard to make sense. And if you decide to share your data this way, it makes somebody's life really hard. Unlike if you decide to organize it in a proper way, in a proper directory, and I just grabbed one deposited data set from 2 days ago, you will see how much difference it makes in your own life, on your colleague's life, in terms of data organization. Huge difference. Okay, I'm going to stop sharing for a sec before I start talking about data management plans in the tri-agencies, because it is less hands-on. I'm going to stop sharing, look at your empty screens and see if anybody has a question. Thanks, Angie, for sharing your screen. At least I see a lovely face. Sorry, sharing your camera. Anyone has any comments or questions? None of what I said is new to you, but again, all of us tend not to do that. Okay, no questions. Then we can proceed and relieve you earlier. Okay, The next point I want to cover is actually more complicated. It's called data management plans. So if you are a PI or you work with other PIs, or if you work with NIH funding, or if you work with Horizon EU, sorry, or you work with the tri-agencies, and most of you, I assume, do that, you would have heard this term, data management plans. What is a data management plan? Starting in last year, the tri-agencies, with a lot of encouragement from my community, have released the tri-agencies research data management policy. It's a policy of how the tri-agencies are going to approach research data. It has 3 pillars. The first pillar is the institutional. Sorry, I skipped it. The first pillar is institutional strategy for research data. So each institution in Canada who receives the tri-agencies funds is supposed to clearly state how they're going to approach research data at their institution. We have led this work for a few years in UBC. Our UBC policy and the research data strategy is on this website called rdm.ubc.ca. I've co-led this work with my colleagues in the NVPRI. Is one of the associate vice presidents of research, Matthew Evenden. So we have a policy, we have a strategy for UBC. It's here, and it can become kind of we promised what we are going to do as an institution. However, in the tri-agencies, the other 2 pillars are actually applying to you as PIs and researchers. One is the data management plans, and the other one is data deposits. Let's talk about data management plans, because I'm going to talk about data deposits in June, and I'm going to show you our 2 solutions for data deposits. Today, we'll talk about data management plans. Data management plans are required by the tri-agencies. It's a gradual introduction for the tri-agencies. Each agency introduces it in a different way, and I will be explaining myself in a sec. But it means that when you apply for grants for the tri-agencies, you will be asked to explain what you do with your data. In no way you are being asked to make your data open. Data management plan is not a promise to make your data open, especially in your areas of health sciences or indigenous data or sensitive data. It's a document that explains how you're approaching your research data as a whole, as a project. What are you going to do with your data? So I have a guide here. Again, it's all, as usual, it's a 1-pager that tells you what is a data management plan and how to approach it. You, I assume, work mostly in CIHR and SHRC, and CIHR requires those 4 initial grants to submit a data management plan. SHRC requires the partnership grants. It's changing this year, it was the pilot starting with last year, it's 2023. 2024, all CIHR grants and the most SHRC grants will be requiring a data management plan. In short, it's called DMP. So DMP is a 1- to 2-pager document that explains what you as a PI or your colleagues do with your data throughout the life cycle of your research. To address that, my colleagues and I have introduced a piece of software back in 2013, actually, and that software is called DMP Assistant. DMP Assistant is a bilingual piece of software. We host it centrally in Canada, University of Alberta, actually. And this piece of software is open source, and it creates the data management plan for you. We ask you questions, and as you answer your questions, we give you the plan to attach for your tri-agencies application. So if you click on that link, it'll take you to the software. It's sorry, I actually I'm logged in, so I'll log out. It looks like this. It's a It's a piece of software that you have to create an account. CWL is coming this summer. We are not there yet, but it will be CWL for you to log in. And once you do, you have an option to create a plan. I'm going to use my existing ones. It looks like this. It looks like 6 sections. Well, usually 6 or 7, depends what kind of sensitive data you're dealing with. And as you answer those questions in those sections, for instance, we start to ask what kind of data you collect. On the left, you have the box to answer it. On the right, you have the guidance for UBC. So when we talk about data storage, for instance, let's actually do that. When I talk about data storage, we give you the tools specifically for UBC. So we tell you what kind of storage to use. We recommend you what kind of storage to use for your research project. If it's sensitive data, if it's not sensitive data, if it's big data, if it's small data, when to use the advanced research computing, when to use OneDrive, when to use Compute Canada, now called Alliance. It really depends on so many things. As you answer those questions, and none of them is mandatory, by the way. You answer them as you see fit. And as you answer those questions, you will create the plan on the fly for you, and you can share it with collaborators, or share it as a download and include it in your agency application. So it is really a piece of software that creates the data management plan for you by giving you the questions and the guidance for those questions. So I encourage you to take a look. We have a lot of examples, especially in health. And this page, I have examples here. They're bilingual, and those are examples which we share in Canada. So we work together. Unlike many schools and states, in Canada, we tend to work together a lot. So almost every piece of work we do is shared between institutions. Like we have one tool to create data management plans for Canada. We have one set of examples. We have one set of guidance, and so on. We do everything together because we have been trying to harmonize our guidance across Canada. So look at this page. If you are asked to create a data management plans, it will be as simple as Googling DMP's UBC, and you will see a variety of guidance that I provide, including examples. And we have the software to do it as well. It's the software, just now you're familiar with it. Answer those questions. I have guidance for each of the categories. So if you want to talk about data storage, I have quite a lot of guidance here. So I tell you how to save your data. For instance, follow 3-to-1 data rule. This is an important rule from experience. So you have to have 3 copies of data in 2 different formats, one off-site. And believe me, if you don't follow it, well, at least have 2 copies of data, you will have issues. You will start losing stuff. If somebody steals your laptop and your data is only on a laptop, then you're screwed. And I have seen it so many times. I'm looking at the chat. Siobhan is sharing some links. I'm not familiar with the journal. I'm not familiar with that group. I'm not surprised they are setting a DMP template. We have quite a few of them for clinical trials. So I will actually, Siobhan, if we go back to DMP homepage and create a plan, we'll call it the May 2024 test. And we are coming from a University of British Columbia. The templates are here. So there's a variety of templates to use. We have the UBC template, which has my guidance. But there's also, well, that's not my guidance, it's actually guidance from advanced research computing, from ethics. It's all harmonized. We have done it together. We have a working group on campus that ensures that everything we say about research data is on the same page between faculty of medicine, your own faculty, advanced research computing, UBC ethics, and UBC library. We really we really worked for the last 5 years to harmonize our language. This is a template for systematic reviews, a template for clinical studies as well. Funny enough, your Faculty of Medicine has a team, not funny enough, it's very actually excellent. Faculty of Medicine has a team. I forgot the name of the team. Kenny, I forgot the name of the team, and that team actually helps you with data management plans as well. Let me just bring my. I removed my bookmarks for this workshop, so you don't see it. But the Faculty of Medicine UBC data management plans. They have a template. I worked with them, the research technology unit, and they have a template they started with a READCap. So if you actually work with a READCap, unlike my guidance, which is just the guidance, I don't give you the answers for those questions in the DMP. I give you the help that you might need. When I worked with Faculty of Medicine, the sample DMP that they did have the answers. They actually tell you what to answer, what to say if you work with a READCap. They will tell you that if you work in what to say for storage, for instance, it's the same categories, but they give you the answers. That's the big difference. And we are working with them on additional pre-filled DMPs. But that can be helpful too, especially if you work in it with the same tools like READCap or clinical trials. Oh, those guys in the University of Ottawa, yes. So I'm very much aware of them, Shimon. There's a few groups that we work together, and they would be working in this area, and they will be working on clinical trials indeed for DMP, and that will be helpful. But again, this is guidance only; those are not the answers. If you want specific answers, like how to answer those questions, you can either use our guidance or use Faculty of Medicine, which gives you the answers, like how to name files. And they use my guidance, how to name files. And they have just implemented it for READCap specifically. So we are trying to harmonize this work across campus. And it's really hard because we have so many stakeholders, we have so many people, so many agendas. But so far, so good. We have been working for the last 10 years to do that. Going back, this is data management plans in short. So I showed you the software. Each section of the plan is explained on my guide. And I give you a variety of stuff, like where to keep the data. What do we have access to? Is it free? Is it FIPO compliant? So there's lots of stuff to refer back to, but again, this is not for 10-15 minutes coverage. And again, everything we say here is remashable. You can take the content, each of those sections is a link. You can remash it into your own websites, your own content. Just don't forget to make sure with the license that we ask you to apply, just cite us when you decide to reuse the content. I will stop sharing and get your questions. Hopefully we'll have some kind of discussion because it has been quite lonely. If you have any comments, happy to listen. If not, I will give you 15 minutes back.
I just wanted to ask a small question. I mean, the DMP Assistant that you showed us seems like a really, really valuable tool for people applying for grants. Is it a tool you would also suggest that labs use just internally, like for their own plans, or is there something else you would recommend?
It's an excellent question. That's really interesting question for labs or for teams. It's a question we have actually been dealing since 2013. When we actually put the first data manager in Hip Health. I don't know if anybody here has worked with Hip Health before. It's a large research center, and after 10 years, I'm happy to share that the easiest way to deal with research data within a team is have a data manual. Not to do data management plans, but have a little data manual where you explain what happens in your team, in your project with your data. I have examples. I have examples from life sciences. I have examples from health sciences. If you want to see how it looks like, this is really helps in terms of having new postdocs coming in and out, new grad students coming in and out, new undergrads coming in and out. When you tell them, okay, when you work with data, that's how I want my files named. This is where I want my files saved. This is how I want my files formatted. This is where I want my files to have access to. These are the options to store your data. This little data manual is, I find, quite essential for many teams, and it will be yours. It will be yours to manage. We can help you to create one, but a lab data manual, a team data manual is essential. DMP is great too, but it's not the same. DMP is really for the DMPs are facing out. They're facing the funders usually, and they're facing the public, and they're asking, they're explaining. You explain yourself to the world, while in the data manual you explain yourself to a team, different audience.
Okay, yeah, that makes sense. Yeah, you were mentioning making it sense, having it make sense to new team members, and that would also add having it make sense to your future self.
Absolutely, 100%. Yeah.
I'm sure a lot of people have the experience of going back to their old projects from years ago and like, I don't remember what I did. So
well, that's the idea of README files, Nicole, right? It's exactly that. Like I didn't say it enough, but that's the idea of README files when you explain yourself to yourself, really, and like I drilled it in my kids so much they actually started doing it, and it's essential. Like it's essential for them to understand okay, I'm an undergrad now. I will be in grad school. What did I mean 5-10 years ago? I will find an example of a data manual, Nicole, and I will send it to you if you want to distribute it as well. I cannot have it handy right away. It's, I know where to find them.
Anyone else want to elaborate on anything or have any questions?
I have a question. I would say, Eugene, what is like your #1 mistake that you see people make and that is so easy to fix? Like if you had to give one piece of advice besides how to name your files and create a README file, because I think you've covered those, what would it be?
The biggest mistake is storage, Shivan. So the biggest mistake is keeping one copy of your data. You won't believe how many times it happens. So you collect your data. We have a researcher who went to Nepal, did research in sickle cells, collected like 50 terabytes of data, and got his laptop stolen. So it's so often happens. So the idea of backing up your data and synchronizing the backups, I didn't cover any of that, but this is a very important. And it's on my. If you just Google UBC research data storage, you will see my ideas. Keep at least 2 copies of your data in at least 2 formats. By formats, I mean one on your machine, if you use a machine, or one on your external hard drive. If you don't use your machine, you keep one on external hard drive and keep one in OneDrive. It's really like this is so painful to see when people lose their data, and some of it is sensitive. And we didn't talk about sensitive data at all. Like I didn't even touch about it, but this is biggie one. Like how do you deal with sensitive data? Walter, you have a question?
Yeah, thank you, Eugene. Thank you for the presentation. I'm wondering about these learning health systems that are being implemented in Vancouver, for instance, and elsewhere. Do we have already a guideline or something related to it? That's when, you know, we publish research as well as health data in the same system, and the system is learning not only from actual clinical data, but also from research data. And they're implementing this here. I wonder if any of these data management
AI initiative for UBC. The problem is there's so many. So as an institution, as UBC, we do not have a harmonized approach to AI. We did not decide as an institution how to deal with machine learning. When you combine your articles and data together, we have not decided as an institution. We don't have a strategy for AI. We do have a strategy for research data. Now, if you mean if you mean micro level data, like stuff that is in POP data BC, that's what maybe you mean. Do you know what POP data? POP data BC is a population data BC where we keep it's just like a data vault when the private micro level data is being kept. It is not public in any way. You have to access it only using the POP data BC data structures. That will be completely different as learning health systems. I'm reading the chat. I think it helps me to. I am not aware. I don't know what you actually mean. What you mean by learning health systems?
Just send a link.
Thank you. I will review it. It was coming from Vancouver Coastal Health.
For instance, I guess that's the way to go. You integrate electronic health records with research data, and I guess.
And you make and is it a public like a public facing interface?
No, I don't think so. Yeah, no.
Because that would be really scary for me. Like
yeah.
So internally facing data for research teams, there is a huge amount of money being invested in it. Especially I talked to Ministry of Health a few times as a consultant, and they're very much interested to support initiatives like that. So they are throwing money at initiatives like that when the researchers within a specific group can make sense of the health sciences data coming from as many sources as possible. But they are really not aware. I'm not aware of what you're sharing. So I need to read and come back to you if you want me to follow up.
I think it's a recent initiative. I don't really know how it works. I was just wondering if you knew and if there were any guidelines. So yeah.
No, I don't know anything about it. In fact, thank you for sharing, and I will actually make sure we know about it. I make sure I share it with my colleagues in advanced research computing as well, so they are aware of this work. I'm keeping it open. I will leave it for tomorrow and I will review it. Thank you.
Thank you.
Oh, it's almost 5 o'clock. Thanks so much, Nicole, for inviting me. I don't know how useful it is because again, I just touched on things, and every one of those topics is an hour by itself. I teach a 3-credit grad course on research data, and it takes us 4 months to cover it in detail. So we just touched on it. If you're interested, please keep in touch. The email address on each of our pages, and happy to discuss things. I lead the UBC strategy implementation for data. So if you want to see what we do as an institution, I'm always happy to share.